Welcome to MI Radio's Myanmar Today. I'm Melody and here are today's reports. Amyotha Hluttaw discusses implementation of national mental health policy. YRTA to collaborate with YCDC in YPS transition. Thaketa crocodile farm to create bizarre programs to animal lovers. Government carries on control measures in possible places of huge crowds. Before we get to the reports, let's take a look at the feature local news for today. President U Myan attended the year 2020 Environmental Green Activities Monsoon Season tree planting ceremony held at plot number 20, Po Zauntown Forest Reserve by Naypyidaw Takon Road 1 at 7:30 a.m. on Thursday. Also present at the ceremony were the Vice Presidents U Myan Sway and U Henry Venthiu, Union Ministers, Deputy Ministers for Natural Resources and Environmental Conservation, Permanent Secretaries, and the officials concerned. At the ceremony, President U Myan planted mahogany tree. Similarly, Vice President U Myan Sway planted teakwood tree and Vice President U Henry Venthiu planted eugenia tree at the designated places. Next, the Union Ministers, Deputy Minister for Natural Resources and Environmental Conservation, Permanent Secretaries, and the officials concerned planted the trees at the designated places. Later, the President inspected the trees planted at Plot 20, Po Zauntown Forest Reserve. The chairperson of Central Committee for the Development of National Races, State Councilor Daw Aung San Suu Kyi, met with the departmental officials of Kokokjon Township, Yangon Region, and inspected the Basic Education High School and People's Hospital on Thursday. The state councilor and party were welcomed by the township-level departmental officials, township elders, and the local residents. Next, the state councilor met with the township administrator and township-level departmental officials at the office of Kokokjon Township General Administration Department. Next, the state councilor encouraged the local residents and give the necessary guidelines including township's education development, transportation, health and COVID-19 prevention measures, election matters. Then, the state councilor concluded her speech wishing physical and mental well-being for the local residents. Afterwards, the state councilor and party inspected the Kokokjon Airport by motorcade, waved to staff members and local residents, left Kokokjon Township by special flight, and arrived at Yangon in the evening. The second coordination meeting of Myanmar Parliament delegation to attend the 41st IPA General Assembly, which will be held from the September 8 to 10 via video conferencing system, was held at Zabudiri Building Parliament Compound in Naypyidaw on Thursday. At the meeting, the leader of Myanmar Parliament delegation, Union Parliament Deputy Patron U Tuntun Hain, said that one draft proposal for Political Affairs Committee from IPA Secretariat, 15 draft proposals for IPA Executive Committee, and the topics of draft proposals for other committee have been received. The relevant committee members are urged to discuss and give suggestions to reply Myanmar's delegation opinion and stance upon the draft proposals. And I believe it's time now for our first report. According to the statistics, 77 out of 1,000 citizens in Myanmar are suffering from a kind of mental disorder, and 8 people out of 1,000 citizens are losing their life by committing suicides. Proportionally, there are only 2 psychiatrists, 0.32 nurse, and 0.01 medical officer for every 100,000 people, and there is still no clinical psychologist in Myanmar. At its 9th-day meeting of the 17th regular session, Dr. Zaw Lin Tut, Hluttaw representative, Mon State Constituency 9, raised an asterisk mark question about how to implement the national mental health care policy by providing effective treatment and protection to the patients with mental disorder.
At its 9-day meeting of the 17th regular section, Amyotha Hluttaw representatives discussed implementation of national mental health policy. Dr. Solinto, Hluttaw representative, Mon State Constituency 9, raised an asterisk mark question about how to implement the national mental health care policy by giving effective treatment and protection to the patients with mental disorder.
ကျန်းမာရေးနဲ့အားကစားဝန်ကြီးဌာနအနေဖြင့်စိတ်ကျန်းမာရေးဆိုင်ရာယောဂဝေဒနာရှင်များကိုထိရောက်စွာကာကွယ်စောင့်ရှောက်ကုသမှုပေးနိုင်ရန်အမျိုးသားအဆင့်စိတ်ကျန်းမာရေးမူဝါဒအားညီတို့ချမှတ်ဆောင်ရွက်မည်ကို
A mental health patient from my constituency was given 6 different sleeping pills and injections for nearly a month instead of discussion or consultation on patients' mental conditions. Psychiatry is different from any medical treatment, and the psychiatrists are not sufficient enough for the mental disorder patients by giving medical treatment to them with medicines, but they have to give more time and must have patients with consultation depending on the mental conditions of the patients. Most of the treatments for mental illness in Myanmar are still in the form of drug treatment, and there's no widespread regarding the relevant therapy or treatment. In a community level, the patients with mental illnesses are taking the long-term drug treatment like 10 years, 20 years, and even the whole life. The sufficient workforces are also needed in the mental health care service. Proportionally, there are only 2 psychiatrists, 0.32 nurse, and 0.01 medical officer for every 100,000 of people, and there is still no clinical psychologist in Myanmar.
Following that section, Dr. Myalisi, Deputy Minister of Health and Sports, responded to the questions on implementing the national mental health policy.
New normal condition တွင်စိတ်ယောဂစိတ်ကျန်းမာရေးပြဿနာများပုံမပြနေများပြားလာနိုင်သည်ဖြစ်ရာပြဿနာများပေါ်ပေါက်လာရမှဆောင်ရွက်ခြင်း reactive တဲ့ကြိုတင်ကာကွယ်ခြင်း proactive
In this new normal situation, the medical workers are conducting the proactive schemes than reactive way to a situation. The Ministry of Health and Sports are proactively conducting the mental health care education, mental health examination before colleges or works, mental health screening to pregnant women as far as we can reach. The psychiatrists in Myanmar are treating the mental disorder patients with biopsychosocial treatment, and the medication treatments for mental disorder are in accordance with international mental health guidelines. We are still weak in treating with psychosocial schemes, but the Yangon Mental Health Hospital is systematically treating the patients with hospital-based psychosocial rehabilitation. This psychosocial rehabilitation treatment includes patients' regulated daily activities, vocational training, and social skill training, and others.
According to Dr. Myalisi, there is no clinical psychologist in Myanmar, and so the psychotherapy treatment is not much available. So the Ministry of Health and Sport is cooperating with other relevant ministries for ensuring the sufficient mental health workforce.
ကုကန်းစိတ်ပညာရှင်များအဖြစ်မွေးထုတ်နိုင်ရန်စိတ်ပညာဘွဲ့ရသူများကိုအဆင့်မြင့် degree ဖြစ်သည့်ကုကန်းစိတ်ပညာရပ်မျိုးမျိုး clinical psychology.
The Ministry of Health and Sports, cooperating with the Ministry of Education, are trying to train the people who are graduated with psychology to produce as a psychologist. They are trained to learn the clinical psychology in master degree and learn clinical attachment. And the people who are graduated from Yangon University Psychology Department Center of Excellence are being trained for clinical psychology as master degree. The new medication curriculum is also being drawn, and the new integrated medical curriculum will be included more about mental health, especially behavior and social science. The next generation medical workers are going to provide basic mental health care service more. We are producing the mental health nurses from the University of Nursing and planning to produce more numbers. And the occupational therapists are also going to be produced in cooperating with the Ministry of Social Welfare, Relief and Resettlement and the Ministry of Education.
The most common mental disorders in Myanmar are anxiety, neurosis, depression, psychosis, alcoholic psychosis, drug-dependent psychosis, and epilepsy. According to the statistics, 77 out of 1,000 citizens in Myanmar are suffering from a kind of mental disorder. There are 38 patients with anxiety, 5 patients suffering depression, 23 patients with alcoholic psychosis, and 2 patients suffering epilepsy in every 1,000 citizens. According to the WHO statistics data in 2016, 8 people out of 1,000 citizens are losing their lives by committing suicide.
That's the report on Amyotha Hluttaw discusses implementation of national mental health policy. According to the report by Yangon Region Transport Authority, more than 80% of issued YPS cards have been distributed to the public till the 3rd of August. And according to the report by YRTA, it is also collaborating with YCDC to expand the YPS shops so that it can be available to everyone. Ye 9 and Zweman reports for MI Radio.
Yangon Region Transport Authority had first introduced Yangon Payment Services from July, where the passengers of YPS can pay the bus fare with the use of card payment system. But at first, it was available to 12 bus lines with the upcoming extensions of other bus lines as well. According to the report by YRTA on 5th of August, it has already distributed 84% of the card. The YRTA also stated that it will soon extend the number of YPS into 15 lines with 700 buses. YRTA held a press conference on 8th of August, and speaking at the press conference, Hluttaw, Joint Secretary of YRTA, said,
Yangon Payment Services
Introducing the YPS from the 21st of July has been the main focus on YRTA in the last few weeks. The YRTA, together with the Yangon regional government, Asia Stammer YPS, have been watching the situation, the progress of YPS, whether what we do is really beneficial to the public or not. What are the changes needed to be made and how we can make it better. Sometimes there can be damage of the card validator by accident, and we are working on all these matters, how to prevent card validators from possible damage. We always open our ears to listen to the voices of the public, where we want to improve the quality of our service center. Apart from GNG, where YPS cards are sold, we're going to collaborate with the Yangon City Development Committee, where the public can easily buy the YPS cards at the bus stops. In addition to the YCDC, we're also collaborating with the Asia Stammer for the promotion of the cards. The main reason we're collaborating with the YCDC and Asia Stammer is we want the cards to be available for everyone to use, because this is the way how we can quickly bring progress to the YPS.
The YPS, which first came into use from 21st of July, is currently available for use in 7 YBPC bus lines with 9 bus routes, 5 of Mahabandula bus line with 6 bus routes, which make a total of 12 bus lines have already started to use YPS. According to the report by YRTA, as this is the initial stage of YPS, the YRTA has working on solving the issues experienced by passengers while using YPS. Do Yikin, Chief Marketing Officer of YPS, also said,
There are only 12 bus lines with YPS, where the total number of buses is 597. We have seen though some have bought the card, the bus they are taking have got YPS, so we don't have many passengers who use the YPS. So far, we have 102 G&G stores where the cards are sold and 3 Asia Stama service centers, which make we have 105 stores in total. We are collaborating with the YCDC for 5 more shops to sell the YPS, and it will eventually make 110 shops overall. The overall report for in the last few is we have had about 606 calls from the public who were just inquiring about the YPS, 37 calls for news information, 51 complaint calls, and most of the complaints have been categorized in error while using the cards. The passengers report that they had been told to repeat the process in paying. Sometimes the card validator is working at the entrance of the bus, but it is not at the exit door, so we have this sort of issue.
For 597 buses with YPS, more than 30,000 cards have been issued to distribute to the public. Till 3rd of August, 25,292 cards have been sold, and together with the top-up, it is worth more than 11.9 million jets approximately. This also makes 84% of the issues cards have been distributed to the public.
That's the report on YRTA to collaborate with YCDC in YPS transition. Under the guidance of the Ministry of Health and Sports, Thaketa Crocodile Farm, the only place of developing conservation of Myanmar's crocodile generation, was open to the public starting from the 1st of August. Crocodilus porosus, known as the species that is becoming extinct, is being mainly conserved in Thaketa Crocodile Farm. It is located on Myanmar Today Street in Industrial Ward, Thaketa Township in Yangon Region. About 546 crocodiles of different sizes ranging from 1 to 10 feet are being conserved in Thaketa Crocodile Farm. This is a report by Zweman, Minton, and Yenine.
Under the guidance of the Ministry of Health and Sports, Thaketa Crocodile Farm, only a place of developing conservation of Myanmar's crocodile generation, was open to the public starting from the 1st August. Crocodilus porosus, known as the species that is becoming extinct, is being mainly conserved in Thaketa Crocodile Farm. It is located on Myanmar Today Street in Industrial Ward, Thaketa Township in Yangon Region. About 546 crocodiles of different sizes ranging from 1 to 10 feet are being conserved in Thaketa Crocodile Farm. Thaketa Crocodile Farm, having an area of 40 acres, is a worth visiting site for observing crocodile species and going for recreation for the public. During the outbreak of COVID-19, it had to be closed for about 4 months. Now it has been reopened to the public, but the number of visitors is not that many. Therefore, further programs like awareness and demonstration have been planned to capture the interest of the public on the public holidays.
Ready? 1, 2, 3.
Dr. Myomin Lai is the deputy director of Thaketa Crocodile Farm, and he said,
Our objective
is to conserve the crocodile species. There were 4 crocodile species in Myanmar in the past, but only Crocodilus porosus seawater species is left, and it is also on the list of extinction. Naturally, the crocodiles are being conserved in Bogale, Ayawari region, regarding it as the natural conservation area where it is home to about 100 crocodiles. It is also open to the public so as to observe the species of crocodiles. No crocodiles are found in Republic of Korea, Japan, and Western countries. The seawater crocodiles live in hot regions.
Before the outbreak of COVID-19, the number of foreign tourists visiting the crocodile conservation camp was about 30 to 50 in a month. In the peak season, there were about 100 foreign tourists. During the previous fiscal years of the 2018-2019, there were about 800 to 1,000 foreign tourists. The number of domestic tourists was about 15,000 to 20,000. U Dain Luen, the crocodile analyst of number 3 Crocodile Conservation Point of Thaketa, said.
There are many salient points to study the crocodile. Its legs and hands are not the same in size. It has 7 eyes shells, but it has no tongue. It has sensible eyes to be aware of something. I would like to Myanmar people to search such kinds of knowledge from now on. This is not an animal that doesn't give danger. If they grow to 6 or 7 feet long, they have to be chained into the reproduction pond. This size of crocodile can pose a danger. In this stage, they can jump well.
The animal lovers can study the different sizes of crocodiles, ranging from 1 to 10 feet, and they can feed the foods to them. Now, in charge of incubation room of number 1 Crocodile Conservation Point, spoke to MI Radio.
The female crocodile lays eggs from April to July. We have to search the crocodile eggs in the forest, and they have to be taken into incubation room, and they have to be put into the cow container. When they are 90 days old, baby crocodiles hatch out. They have to put into incubation room for 45 days, and they have to be fed. When they are 2.5 months or 3 months old, they have to be transferred to number 1 pond. They have to be put into the number 1 pond until they are 1 to 3 feet long. When they are over 3 feet long, they have to be transferred to number 3 pond. They have to be put into number 3 pond until they are 3 to 7 feet long. When they are 7 feet long, they have to be transferred into natural drinking pond.
The walkways were formerly made of timber in the 40-year-old Thaketa crocodile farm, and later they were in room. In 2017-2018 fiscal years, they were upgraded into the reinforced concrete bridge. In 2018-2019 fiscal year, gas holes were built with reinforced concrete. Now, Thaketa Crocodile Farm has been opened to the public. The entrance fee for Thaketa Crocodile Farm costs 500 kyats per domestic visitor and 1,000 kyats per foreign visitor.
That's the report on Thaketa Crocodile Farm to create bizarre programs to animal lovers. Let's move on to the last report for the day. The government is carrying out control processes capable of stopping the possible occurrence of the second wave of COVID-19. The reported COVID-19 cases in the country are quite a few number. Only 1 case in a day and sometimes 1 case in 2 days. It seems to be good and in a stable condition.
The government is carrying out control processes capable of stopping the possible occurrence of the second wave of COVID-19. The National Level Central Committee of Prevention, Control and Treatment of the COVID-19 reissued a notice on the substitution of the ban of gathering not more than 5 persons with that of not more than 15 persons on 29th of July. The government also extended the restrictions until 15 August due to prevention of COVID-19 outbreak, which excludes the measures lifted. The period of operating the international flights has also suspended until 31st August. The reported COVID-19 cases in the country are quite a very few number, only 1 case in a day and sometimes 1 case in 2 days. It seems to be a good and stable condition. People are still going out with the reasons for their social and economic matters. The stability of reported cases in the country reduces the people's awareness in protecting themselves. Uthanaiu Region Hluttaw representative from Babedan Township Constituency 1 shared his opinions on how the second wave can occur when going to crowds.
People still seem to be careless in following health measures, as this disease will take much longer to completely disappear. Each and every citizen must wear the mask. Even wearing masks is not totally safe. Social distancing, avoiding crowded places, washing hands should be done by everyone. As we all know, there are also asymptomatic cases, so it is no good in going to crowded places because no one can see the virus carriers. The government is controlling greatly in order to reduce the crowd. The crowds can be the only place for the asymptomatic patients to spread the virus. We can see there are people who are wearing masks and also who don't wear masks, so the crowds can be the only reason for the virus to occur back again. Now the positive cases are only from foreign returnees, so we have prepared the quarantine centers, stay-at-home plans for them systematically. One thing I'd like to suggest is people are to wear masks.
COVID-19 situation in India, which is the neighboring country of Myanmar, has got up to third place all over the world when the second outbreak occurs. Also in Vietnam, which has no deaths in the first wave, has increased to 9 deaths on 6 August. The union minister also urged the people to avoid crowds, to follow the 6 feet apart social distancing, to wear masks whenever going out, and to wash hands for 20 seconds. The announcement also includes that as the many countries in the world are rising in positive cases with the second wave infection, people should follow the guidelines properly. Dr. Sidolin, a specialist from Yangon Workers Hospital, said about why our country is still in stable condition.
The infection rate of this disease can rise. Together with the deaths all over the world, the reported positive cases are different due to the different measures of each country's medical equipment and specialized treatments. As we all know, the infection rates and the lockdowns in our neighboring countries become high again. The lockdowns are not suitable for everyone as COVID-19 impacts not only on health, but also on economic and social matters. One good thing of our country is that the government can control the foreign returnees very well by making them put into quarantines. We have to look forward at how long we can keep this situation stable. When the international flights are relaunched back again, we will need to consider how the government will handle the situations.
There are altogether 12 regions and states that are free from the virus. 289 people among the positive cases have been discharged from their respective hospitals because they have tested negative for 2 times consecutively. There are 61 active cases in the country that is under the treatments, according to the data released from the Ministry of Health and Sports on 5th August. In Myanmar, the COVID-19 positive cases have reached 357, with 305 recoveries and 6 deaths, according to the data released at 8 a.m. on 6 August.
That's the report on government carries out control measures in possible places of huge crowds. Now we move on to international news. At the invitation of his U.S. counterpart, Chinese National Defense Minister Wei Fenghe held a phone call with the U.S. Secretary of Defense Mark Esper on Thursday. The two sides discussed ties between the two militaries and exchanges during the next phase. Wei stressed China's stance on South China Sea and Chinese Taipei, asking the U.S. to stop its wrong deeds, manage maritime risks to avoid dangerous moves that may escalate tensions. Esper said amid current tensions, talks between two militaries should be maintained to avoid miscalculations. The International Federation of Red Cross and Red Crescent Societies on Thursday said monsoon floods are robbing millions of people of their homes and livelihoods in parts of South Asia, including Bangladesh India, and Nepal, with mounting risk of more deadly disease outbreaks when health resources are stretched to breaking point by COVID-19. Quoting the government figures, IFRC said so far, almost 17.5 million people have been affected and more than 630 killed by major floods in India, Bangladesh, and Nepal. Half of Bangladesh districts are underwater, leaving nearly 1 million families stranded and cut off in their villages, RFCA said in a statement. It said flooding and landslides in Nepal have left almost 200 people dead or missing. It added in India, almost 12 million people are affected by the floods, mainly in the northern states of Assam and Bihar. According to IFRC, the monsoon season floods mean a high proportion of the population in South Asia is vulnerable to diseases such as dengue, malaria, lepto, and cholera. The majority of limited hospital beds, doctors, and health resources have been redirected to focus on COVID-19 response, as India deals with more than 50,000 recorded cases a day. IFRC said adding Bangladesh and Nepal have surpassed 240,000 and 20,700 confirmed cases, respectively. According to the IFRC statement, South Asia now has more than 2.2 million cases of COVID-19 cases, with fears that the total number of infections are much higher. TikTok, the embattled short video app that has found itself at the center of China-US tensions on Thursday, announced it will set up its first European data center with an investment of $500 million in Ireland. Roland Cloutier, Global Chief Information Security Officer of TikTok, said in a statement the project will create hundreds of new jobs and play a key role in further strengthening, safeguarding, and protection of TikTok user data. Cloutier said the data center, which is expected to open and be operational by early 2022, signals the firm's long-term commitment to Ireland. TikTok said earlier in a statement that it will stick to globalization despite difficulties, including the intense international political environment and rival Facebook plagiarism and smearing. That's all with the news and reports on Myanmar Today. Hope everyone is staying safe.